HealthTalk show, the show where we break down health topics that actually affect our daily lives.
I'm Anna.
And I'm Moon, your host for today's episode.
Now, let me ask you something simple. What do I symptom that seem harmless but can become really annoying if it doesn't stop?
Easy! Coughing! Coughing may look minor, but when you keep going, it can disturb sleep, affect works, and reduce quality of life.
And many people experience cough. Many of them go straight to cough medicine. Usually drugs that as antitussive will suppress the cough effect.
However, what many people don't realize is that antitussive actually comes in different pharmacological classes, each with different safety profile.
To help us understand this better, we will join today by two pharmacists connecting with us live and live.
Okay, hi Aina, how are you today?
I'm doing well, thank you. I'm really happy to join you all for today's talk show.
Hi Aida, how are you meeting on your side today?
Hello Erna, I'm great, thanks. I'm excited to be here and share some insights on cough medicines with everyone.
Fantastic, we're so glad to have both of you with us. Today we'll be talking about something that affects almost all of us at some point. Cough, and the medicine used to treat them.
Exactly, and what makes this discussion even more interesting is that we are comparing antitussive medication from different classes, opiate vs non-opiate. So you can see how their effect and safety differ.
Joining us on the screen, pharmacist Aina will be discussing the non-opioid antitussive, which is the drug called dextromethorphan.
And alongside her, pharmacist Aida will explain the opiate antitussive, which their drug called CODEINE.
Without further ado, let's start our discussion. Aina, let's start with you. Could you explain what dextromethorphan is and how it works?
Of course, dextromethorphan or DXM is a non-opioid antitussive used to provide temporary relief of dry, hacking cough caused by minor throat or bronchial irritation, often triggered by common cold, flu, or inhaled irritants like dust or smoke. It's a centrally acting antitussive, specifically an NMDA receptor antagonist and sigma-1 receptor agonist. Although it's a D-isomer of a codeine analog, it does not have significant opiate-like effects at therapeutic doses.
Thanks for that, Aina. Just to make it easier for our viewer, can you explain which age group can safely use DXM?
Sure, DXM is generally safe for adults and adolescents aged 12 above. For children 6 to 12 years, it should be used only under medical guidance, and also children under 4 to 6 years should generally avoid it.
And what about people with health condition? Anything they need to watch out for?
Yes, people with asthma, COPD, or liver issues should be careful, and those taking MAOIs should avoid it to prevent complication.
Great. And dosing? What would a standard adult take?
Adults typically take 10 until 20 mg every 4 hours or 30 mg every 6 to 8 hours, maximum 120 mg in 24 hours. It's available as syrup, drops, lozenges, and also as tender release forms. Price range is approximately 10 until 20 ringgit.
And side effects?
Common ones are drowsiness, dizziness, nausea, and GI upset. Rarely, confusion or agitation may occur. At very high doses, abuse can cause hallucinatory effects called robotricking.
Thanks, Aina. Just one last question for someone experiencing a mild dry cough. Is DXM a suitable option?
Yes, for mild to moderate, dry, non-productive cough, DXM is often recommended as a first-line choice.
Perfect, that really helps our viewer understand DXM better.
Thanks, Aina. This really clear thing up. Now, let's move to Aida and talk about CODEINE, that opioid antitussive, and see when it might be needed instead of DXM. Aida, now we turn to you. Could you explain that CODEINE is and how it works as an antitussive?
Of course, codeine is an opioid antitussive mainly used for symptomatic relief of severe dry cough. It acts as a weak opioid receptor agonist and is often chosen when non-opioid options like DXM aren't sufficient, or when a cough is severe enough to interrupt sleep.
Thanks for clarifying. Can you tell us which age group can safely use codeine?
Adults can use codeine, but it requires a prescription. Children under 12 years old are generally contraindicated, and some adults with respiratory issues or recovering from surgeries like tonsil or adenoid removal should also avoid it.
And are there special considerations for people with liver, kidney, or genetic differences?
Yes, codeine is metabolized in the liver by CYP2D6 into morphine. Some people, called ultra-rapid metabolizers, convert it too quickly and risk overdose even at a normal doses. So, patients with respiratory, liver, or kidney problems should be extra cautious.
Got it. And And dosing? What should adults know?
Adults typically take 15 to 30 mg every 4 to 6 hours in form like linctus, tablets, or combination elixirs. It best taken with food if GI upset occurs. Use should be short-term only, up to 3 days.
Side effect, what should we will be aware of?
Common side effects include constipation, drowsiness, nausea, and dry mouth. There are serious risks too, such as respiratory depression, hypertension, and potential for addiction or misuse, so it should be used carefully.
Thanks, Aida. Just to sum up for our viewers, codeine is effective for more severe or persistent dry cough with careful monitoring and prescription guidance.
Perfect. That gives a clear picture of the antitussive like codeine.
So, Aina, after everything you have explained about DXM, if someone has a mild dry cough, why would they pick DXM instead of codeine?
Well, DXM is generally safer for everyday use, doesn't cause constipation or breathing issues at normal doses, and you can usually get it over the counter. It's perfect for short-term relief when the cough is mild and non-productive.
Got it. So basically, DXM is the go-to for user. Annoying cough that keep you up at night.
Exactly. Something simple like a scratchy throat or a little tickle in the chest, DXM is enough.
Cool. And Aida, flipping to codeine, when would a pharmacist say, yeah, codeine is needed?
Well, codeine is usually considered when non-opioid options like DXM don't work, or the cough is severe enough to interrupt sleep. It's stronger, but because it's prescription only and comes with some side effects, we use it carefully.
Interesting. So for our viewer, it's kind of like DXM for the leisure office go, codeine for the can sleep all night, hiking cough.
Exactly, that's a good way to put it.
And just to make it super clear, the decision really depends on the cough severity, the patient's overall health, and how safe the drug is. DXM equals to quick, easy, and safe. Codeine equals to stronger, more controlled, and for serious cough.
Perfect. I think that I really help everyone watching understand which each option is appropriate without overwhelming them with too much medication lingo.
True. Well, that's wrap up today's Health Talk. A huge thank you to our wonderful pharmacists, Aina and Aida, for sharing their expertise and guiding us through the world of cough medicines.
And thank you to all of you watching. Quick question to discover whether need to think which suit your family best.
Let us know your thoughts in the comments or chat below.
Remember, safety is key. Follow the directions, pay attention to your health condition, and never hesitate to consult a pharmacist or doctor if you are unsure.
We truly appreciate Aina and Aida for helping us break down the science in such a clear, practical way, from everyday DXM to the stronger prescription codeine.
Stay safe,
Take care of your coughs, and we'll see you
next time.
After watching this HealthTalk video, I gained a better understanding of how cough medications are selected in pharmacy practice. One important value highlighted is patient safety, as different antitussives carry different level of risk. The video also shows why patient-centered decision making is important, because medication choice should be based on the patient condition and the severity of symptoms. I learned that pharmacy personnel must be choose medication safety and responsibly, always considering what is the best for the patient. Overall, this video helped me understand the ethical role of pharmacy in medication selection.
For our group reflection, I will reflect on the ethical values and also patient-centered decision-making related to dextromethorphan and also codeine. I learned the importance of patient safety and also professional responsibility when supplying cough medication. Codeine carries higher risks such as dependence and respiratory depression, so ethical judgment is essential. Patient-centered decision-making is important because each patient has different risks and needs. Factors like age, medical history, and potential misuse must be considered before choosing the medication. Pharmacy personnel must follow clinical guidelines and legal requirements when choosing between dextromethorphan and also codeine. Dextromethorphan is usually preferred for safety, while codeine should be only used when clearly indicated. Overall, this reflection highlights the importance of ethical and also patient-centered practice in pharmacy.
When patients are involved in decision about their medications, it builds trust, improves adherence, and leads to better health outcomes.
Okay, from this video, we actually learned a lot about values in pharmacy practice, not just about cough medicines. One important value is patient safety. Even though coughs look like a small problem, choosing the wrong medicine can actually cause harm, especially for children or patients with breathing problems. So, safety should always come first. Another value we learned is responsibility. As future pharmacy personnel, we can't just give medicine randomly. For example, DXM is more suitable for mild cough, while CODEINE is stronger and needs careful control. This shows that every medicine has its place. That's why patient-centered decision-making really matters. Different patients have different needs. Some only need a simple over-the-counter medicine, while others may need closer monitoring. So, treatment should be based on the patient, not just the symptom. Lastly, pharmacy personnel can choose medication fairly and responsibly by asking the right questions, taking the patient's condition, and explaining how to use the medicine properly. This helps prevent misuse and ensures the patient gets the safest and best option. Overall, this video reminds us that being a pharmacist is not just knowing about drugs, but also caring for patients and making ethical decisions.